Well, it's time for us to have a conversation about your health, and particularly today we will be focusing on HIV and AIDS with a bias towards men, just trying to understand. Statistics are showing that men are not very enthusiastic about getting tested for HIV. Why is that, and how can we be able to change this? And for more insights on that, I'm now joined by Professor Mohamed Karama, who is a medical doctor as well as a board member at the Kenya Religious Leaders who are affected by HIV. It's good to have you with us this evening.
Thank you very much.
Let's begin with how the Kenya Religious Leaders affected by HIV was born.
Yes, this is a network of religious organizations across Africa. There was very high expectation of religious leaders that they are angels, they don't get problems, and when in the advent of HIV transmission, it was a big challenge to religious leaders because people would not believe that a religious leader could get infected.
Yes.
So they set up an organization, the INERELA, which is the international, and then they had branches in several African countries, and that's where KENERELA was also established as a network of religious leaders who are affected, and this involves all the faiths, Muslims, Christians, Hindus, everybody, so that it can give support to religious leaders who are likely to get into that problem.
And have you seen perhaps the level of stigma going down since the setting up of this particular body?
One of the successes of our organization actually is reduction of stigma and denial. There was stigma, denial, and we worked on that. And fortunately for the religious leaders, we also have the pulpit that we can use, and therefore we have congregations. We have that potential and opportunity to be able to address. And I think we have achieved a lot in reduction of stigma since the inception of the network. Yes.
Okay, let's look at men generally. Why is there reluctance among men to get tested for HIV in your perception?
Actually, men, not only for HIV, even other diseases, the tendencies are that men would be a little more resistant towards rushing towards seeking medical help. The health-seeking behavior of men is unlike women in that they delay and they trivialize health issues quite a lot. And this is something that we need to overcome. And it's a contributing factor in that HIV will not be able to, the levels that we intend to achieve in this country will not be achieved if men do not cooperate in getting to know their status. Yes.
What are some of the excuses that perhaps they use to not go to the doctor or even get tested for whichever disease it is? Some of the common ones that you've had.
Yes, at the advent of HIV, the biggest concern was that HIV was not curable. And therefore, one would rather have his problem with him and go with it to whatever level that it is. There was a lot of denial in the early stages. But currently, I think the issue that maybe contributes to men not fully participating is the issue of stigma. There's still quite a level of stigma, although from the early days, much has been achieved through reduction of stigma, but that level of stigma contributes to men not accepting to know their status.
There's always been the argument, among some men that the fact that, they get tested through proxy, that, when your wife perhaps is expectant, she goes to hospital, she's tested, she's negative for HIV, then they sit back and say, I'm also HIV negative. What would you say to that argument?
It is important that men should also know that we have different types of testing now. We have home-based testing that is conducted by different organizations. We have individual testing. Previously, you had to go to a counselor, be tested in voluntary counseling and testing centers.
Yeah.
And now you don't have to wait for your wife to be pregnant and that you get tested. And normally what men do, and I am aware of this, they only come forward after testing elsewhere and seeing their status that they are negative, then they come in the open. But men who refuse to test, sometimes they might have tested privately and got to know their status, and then they hide it from their spouse.
But is that argument valid, that so far as my spouse has tested negative, then I'm automatically negative?
That also is one of the factors, that if my wife is negative and I believe I am faithful, then I am also negative. That doesn't hold water at all, because HIV is a lentivirus that takes very long to develop, and it is possible that one might have gotten infected long time ago, and the process of the viral load multiplication has taken time, and therefore it's not a justified reason that your wife is negative, so that we have close to about 40% discordant couples. One person is positive and the other one is negative. So it's not a valid reason at all. Yeah.
So how do we change, this perception that, you have said that most men, the reason they don't get, they not want to get tested is in the event that perhaps they're found to be HIV positive, the couple that is, there will always be the blame that it's the men who are promiscuous. It's the men who are the problem.
I think one of the key things that can be done is to appreciate that a lot of success has been achieved in the management of HIV, and that people should not be shy. It's not a death sentence as it used to be, and therefore the community should be sensitized in that HIV can be managed to very stable, and people can live normal lives. They can have children. Previously, in the early stages, for example, the chances of a child born of a mother who is HIV was up to 45%. But now, with the new drugs that are available that suppress the viral load, it is possible that it is reduced up to 1%. So you have a chance to live a normal life, even if you are HIV positive. And many couples are living very positively, and therefore men should not be shy at the moment. Yes.
Are we seeing perhaps an increase in couples now going to get tested for HIV? Or it still remains an individual secret among?
That's the policy, that we need to increase the numbers of people who are testing to get their status, because this is a key indicator of success of the HIV program. If we get to know the status of many people, then it will be possible to control the HIV transmission. So there is a marked improvement in new infections, which is as a result of increased couples testing and also individuals testing for HIV.
What about disclosure amongst couples when people test for HIV?
This is another challenge that exists, especially when somebody is positive. Many of our communities have not been able to manage this information, especially if the man went alone and there was no counseling support for the spouse and so on. And that's where we are encouraging that couples should go for testing, and therefore the counseling will be targeting to prepare them to receive whatever results that come out, whether positive or negative. And but now with technological improvement, you can buy a testing kit in the chemist and test yourself. We just need to sensitize people that if you get positive, maybe if you cannot tell your wife, take her for a counseling session and get the results given out. But that is one of the challenges that we have, sharing out the results and the outcomes of testing. Yeah.
Of course, with the improvements, we've seen now self-testing kits. So where does it leave the fate of, the VCTs, which, has always been a challenge because many people have actually not been going to them because of the fear of stigma that, if you're seen walking into a VCT center, people will think that perhaps you did something, you were promiscuous or you were unfaithful, that's why you're seeking to get tested.
Yeah, there is, that's why I said we have moved, we have transited to many aspects of HIV management. For example, in testing, we have even provider-initiated testing. That is where the health provider feels like suspects you might be having a viral infection or HIV for that matter, that is contributing to your illness, and therefore they initiate. This should be accepted because then if that is not done, people will continue treating you for other things and not addressing the actual problem. So it is important that that is there, and the VCT is important, especially where we have couples, because they package that with the proper counseling for both results, for positive results and negative results. For positive results, to prepare you and transit you to healthcare, refer you to a place that you have continuity of your lives, and for negative results, to ensure that you keep negative. So for couples, I think it should be recommended that if they can go to the VCT, they have that advantage of the counseling that goes in the package, and or if they go to a health facility for that matter during pregnancy or something, as you indicated in the earlier. So it's not good enough to rely on the results of one partner. Yes, whether the man or the wife.
Or the wife.
Yes.
So how do we seal this loophole, particularly for the self-testing, where you generally just go and pick up the kit, go and test it yourself, no counseling, nothing? How are you supposed to deal with that as an individual? How do you prepare yourself?
I think in the initial stages that was a big challenge. We could not do that because there were lots of people lost hope. They knew this was the end, it was my end, I have HIV and so on. But the situation has changed so much that HIV is now manageable. You have several levels of drugs. You have first level, second level, and so on. You can live for your full life managing the problem. The drugs have improved so much, so people they don't have to fear anymore, as it used to be the case in the beginning. So just like the history of the other diseases, we came the same way. Tuberculosis was, people died until science improved and managed to get treatment and so on. Typhoid, all these other diseases. So is HIV now, and we believe the same will happen with corona.
Corona still has a lot of stigma issues, but how do we generally, break the cycle of stigma? Because it's over 20 years since HIV and AIDS, we talked about it, yet we are still seeing stigma to date.
I think we need to go to all levels. Ourselves, for example, the religious leaders, we use the churches, the mosques, the temples, and we give hope to the people that you can survive. And we have religious leaders who have come in the open, accepted the situation, and they have influenced others to overcome the stigma. I think the level of stigma now that remains is not as it was in the beginning. It was much, much reduced now. And I think that can be continued to address some of the remaining levels. through religious leaders and also through other forums, through schools, through other facilities, health facilities and so on. I think it is possible for us to overcome this stigma.
In terms of motivation, what would really motivate someone to want to go and get tested, especially for men? What would make someone just wake up and say, today I'm going to get tested?
One is that HIV is not only transmitted sexually. So it is possible that in the earlier days,
yes,
you might have gotten infected and that the virus has taken much long. And we had different categories of people. There were those fast developers who would take a period of maybe 5 years.
The disease would progress very fast.
Yeah, would progress very fast. And that was long enough also. There were those who would even take up to 10 years without recognizing any symptoms.
Yes.
So it is possible that you are harboring the virus, and therefore it is good to know your status, with the hope that if you are positive, there is a lot of success now in managing HIV. And if you are negative, you can continue to live comfortably.
And for those who are managing HIV, what is the rate of adherence, especially among men? Adherence to treatment.
To treatment.
Yeah.
I think one of the big challenges is the sensitivity of the drug. And I think we have over 90% adherence because that is life itself. But the small numbers of people who don't adhere because of stigma. For example, somebody does not register in where they actually go for their drugs or something. They travel. Sometimes they don't have money to travel so that they are not seen in their own local facility.
Yeah.
This contributes to lack of adherence.
Okay.
And the challenge to that is the mutation, that the virus changes and creates resistance, and somebody very quickly moves from first line of drugs to the second line. That should be discouraged as much as possible.
All right, our time is up, but I'll just give you 10 seconds to perhaps speak to the men out there and tell them why it is important for them to get tested.
I think whether you are a religious leader or you are an ordinary citizen or you are a religious follower, it is very, very important that you get to know your status. It is not just through sex that you might have gotten infected long time ago. It may be through some illness or through some medical approaches that were used. So it is very important that we get tested. And secondly, the success of our HIV program in this country relies a lot on people knowing their status. So it is very, very important that people get tested and get to know. And couples should also accept if your partner is said to be positive, you can coexist and continue living together. Should not be an issue for separation.
It should not be the end.
Yes.
All right. Thank you very much, Prof. We'll have to end it here, but we do appreciate you finding time to share insights on what are some of the things that you're doing as religious leaders to talk about HIV and AIDS.
Thank you very much.
Well, we have been talking to Professor Mohamed Karama, who is a medical doctor as well as a board member at the Kenya Religious Leaders Affected by HIV and AIDS, and just saying the problem still remains stigma, and we can break this particular cycle. It's not the end when you test positive for HIV. Now there are ARVs, so you can be able to access treatment. This is where we put a cap on your health, but of course business news is up next, so stay tuned.